Case scenario. Janice, the unit manager, gets a call at 2:30 a.m. from a distraught assistant manager about a nursing error that has led to a patient's demise. The unit's assistant manager informs her that a patient has been given a large insulin dose intended for a different patient. The nurse failed to check the receiving patient's armband or call the patient by name before administering the insulin. Because it was in the middle of the night, the patient was groggy and did not question why he is receiving medication. Now the patient is severely hypoglycemic, hypotensive, and exhibiting cardiac arrhythmias. The assistant manager reported that Kristen, the nurse, was one of the more senior and experienced nurses. She had an impeccable work ethic with a reputation for being one of the unit's best nurses. She shared that the nurse was absolutely devastated about the error and nearly hysterical. Having arrived on the unit, Janice listened as Kristen tearfully recounted the story of going into the patient's room and administering the medication. She acknowledged that she had not checked the patient's armband because she did not want to disturb the patient who was sleeping. Tonight was her first night to care for the patient who received the insulin and the patient next door who was supposed to receive the insulin. Both of the patients were men in their 70s who had the same diagnosis and had similar physical characteristics and facial features. Both men had been admitted during the day and assigned to adjacent rooms, and both had identical last names, making matters worse. The nurse could hardly speak through the tears as she was shaking uncontrollably. The patient, taken to the ICU due to the underlying conditions made worse by the insulin overdose, unfortunately could not be resuscitated and passed away.